Hey class, I hope you all had a wonderful summer. Now that class is back in session, we have plenty of topics to unpack. Today we will discuss about bronchitis. We will go over the condition, the pathophysiology, and a case study for our better understanding. So sit back, relax, and listen to this podcast. Before we talk about our case study, a big question that is asked is what is bronchitis? Well, let's break it down. So basically, to break it down, bronch stands for bronchi and itis stands for inflammation. Therefore, bronchitis is an infection of the main airways of the lungs called the bronchi, causing them to swell and be irritated. There are two main types of bronchitis, acute and chronic. Acute is temporary or will last for a short time. It arises mainly after viral infections, such as the common cold, or by inhaling irritants like smoke and dust. Acute bronchitis is very common and accounts for 10 million doctor's visits yearly. That's crazy. Chronic bronchitis is a more serious condition. It's a more constant irritation in the bronchi. Chronic bronchitis lasts longer and usually won't go away. Chronic bronchitis does fall under the umbrella for COPD, also known as chronic obstructive pulmonary disorder. COPD, also known as chronic obstructive pulmonary disease, is not just a lung disease, but an umbrella term to describe chronic lung diseases that cause limitation in the airflow of the lungs. The conditions that fall under this umbrella term is emphysema, damage to the air sacs of the lung or the alveoli, asthma, long-term disease of the lungs that causes the airways to become inflamed and narrow, and chronic bronchitis. Now that we know a little bit about bronchitis, let's quickly go over the pathophysiology. First, let's discuss what the bronchi is. So we know it's a large air passage that comes from the trachea to the lungs. We have two main bronchi, and they are in the left lung and in the right. They both then divide into smaller branches that are called the bronchioles. Its function is that it's primarily a passageway for air to travel to the lungs, then to the alveoli, and then go out of the body. The bronchi is made up of mucosa, smooth muscle, and cartilage. The bronchi brings in air from outside, which exposes us to infectious agents. But since our bronchi is lined with mucosa membranes, it gives protection and collects harmful pathogens from getting into the lungs. So how does bronchitis start? Like mentioned before, it usually arises after a viral infection, starts in the mouth and the nose, and suddenly impacts the cells of the bronchi. Normally, our first line of defense is to fight infection or irritants by creating mucus through the glands surrounding the lumen. This basically flushes out the pathogen. Since our body is trying to fight the infection, it causes swelling in the brachial tubes, and this causes coughing and shortness of breath. In chronic bronchitis, it's associated with hypertrophy of the mucus glands, caused by an overproduction and hypersecretion of mucus by the goblet cells, leads to airflow impediment because of luminal obstruction to small airways. The airways get clogged and more irritating, causing this to become more long-term than acute bronchitis.
Now, let's move on to the clinical feature of bronchitis. First, short of breath, fever and chill, tightness of chest, sore throat, body pain, persistent cough, wheezing, fatigue, and headache. Let's move on to the case study details. For subjective details, the client is 49 years old female. She has two dependent grown daughters. She's a real estate broker. She's separated from common law partner and she lives in 4-level townhouse. Here is the past medical history of the client. She has chronic fatigue and stress that is related to her illness, cardiovascular condition that is related to her high palpitation and high blood pressure, and lastly, her cardiorespiratory condition that related to COPD with 30% airway obstruction pulmonary hypertension. Next is the general observations of the client. She is obese with swelling feet, poor physical condition with low activity tolerance, shortness of breath, displays agitation and impulsivity, able to walk around block at medium pace with brief rest break, and lastly, she's able to grocery shop. Now, we're going to talk about the objective details of the client. First, the investigations. The doctor diagnosed bronchitis generally on the basis of the symptom and physical examination. Usually, there is no blood test necessary. Lastly, the doctor may measure the patient's oxygen saturation. Oxygen saturation is a test how well oxygen is reaching blood cells. This test uses a sensor placed on a finger. This referred to as pulse oximetry. May order examination or culture of the sample phlegm that is coughed up to look for bacteria. After all the tests and examination, the doctor diagnosed that the client has pulmonary disease bronchitis. For the intervention, the doctor recommended the client to physiotherapies and occupational therapy. After knowing all the details of the clients, here are the clinical features specifically to her case. First, shortness of breath, swelling in feet, fatigue, stress, display of agitation and impulsivity, hypertension, and irregular heartbeat. Here are the activity limitation of the clients based on her past history and a new diagnosis. First, she's unable to do long walks without rest breaks, unable to go up and down the stairs without resting, unable to clean the four-level townhouse without support, can socialize too much due to display of agitation and impulsivity, and lastly, she's unable to lift heavy grocery bags. Now, we are going to tackle about the participation limitation of the client due to his diagnosis. First, she's unable to do groceries for a long period of time, can hang out too much with her daughters due to her agitation and impulsivity, unable to focus on her work such as showing or touring the houses to the clients due to the shortness of breath, agitation, and swollen feet. Lastly, socialize with other people around her. In addition of all the information that we tackle, we also researched and saw the simple things how to ease the symptoms of bronchitis and how to avoid from suffering it. First, stop smoking, avoid dust, chemical fumes, smoke from other people, wear mask if needed. Steam is also helpful since it can loosen up all the mucus. Breathe in steam from a bowl of hot water. Take a shower. Use Vicks Vapor Rub on your chest. Use a humidifier, but make sure to clean it as directed so bacteria and fungi don't grow inside. Drink lots of fluid, especially water, healthy diet, exercise, and lastly, get a flu shot every year.